Good morning, everyone. Welcome and thank you for tuning in to Health Watch. I'm Dr. Victor Politi, President and CEO of New Health. So as healthcare in America is changing, New Health is part of that change. So this half-hour program will provide you with some essential information about our services and facilities that provide top-quality care that fits into your lifestyle. Well, today it's a little different than usual. We're going to have a special guest, someone who's outside healthcare and you wouldn't think had as much influence with healthcare as they do. But today is going to be Police Commissioner Thomas Krumpter, the Nassau County Police Department. And he's going to be speaking about some of the innovative things that the Nassau County Police Department does as far as healthcare. You don't realize it, but we have one of the most advanced police departments in the nation. This police department, using intelligence-led policing, ShotSpotter, and other devices, have made monumental decreases in the crime rate here in Nassau County, making it one of the safest places in America to live. We all welcome that and enjoy the benefits of what the police department does for us. So Commissioner Krumpter and his crew, his men, his team, are out there every day protecting us. But there's a part of policing here in Nassau County that is sort of unique to Nassau County that very few police departments in the nation perform. And that's part of emergency medical service, where the Nassau County Police Department also provides ambulance services, emergency services to the civilians, to the residents here in Nassau County. And we don't realize, we think we have the volunteer fire departments and the volunteer ambulances, but really one of the main delivery systems here, one of the main responders for our emergencies are the Police Department Emergency Ambulance Bureau. And you'll see them riding around. They're in the regular ambulances, but they'll say, police ambulance, and that's these guys. So I want to really welcome, really thank you, Commissioner, for taking time out of your busy day. I know you're a very busy man, and I appreciate you being here. So why don't you start by telling us a little bit about yourself and about your police history?
Yeah, I'm currently the Commissioner of Police in Nassau County. I've been a member of the Nassau County Police Department for 22 years. And prior to that, I was a New York City housing police officer for 3 years. I've had a number of different positions within the police department, and I'm very privileged to work with the finest men and women in law enforcement in America. Nassau County has the proud distinction of being the safest large community in America, and currently this year, crime is down year to date over just about 10%. And we finished last year with the lowest crime rate in the history of Nassau County. So it's been a real great year, and that's thanks to the men and women of the Nassau County Police Department.
Yeah, we do have some really great police officers and police facilities here in Nassau County. And you put together some initiatives that really made a huge difference, such as some of the intelligence-led policing and your whole intel division, as well as ShotSpotter. So why don't you give us a few seconds of that before we get into the medical stuff?
Well, it's one of the things that we're very proud of is, in Nassau County, everything is driven by intelligence-led policing. When anybody wants to talk about intelligence-led policing, whether it's the State Department, the Justice Department, the FBI, they come to Nassau County. We have visitors on a regular basis, almost every week, from around the world that come and look on the strategies we're using. And at a time where the department's at its lowest strength since the 50s, there are people that would say that crime would have skyrocketed. Well, thanks to the initiatives, thanks to the men and women, it's the exact opposite. Over the last 3 years, crime has dropped almost 20%. And that's from historic lows. So it's we leverage technology, we leverage modern policing techniques, and that's resulted in a significant reductions in crime.
It's amazing. It's great. And you really are a leader in policing. I know you're part of the Major City Chiefs organization, as well as the International Association of Chiefs of Police, and you receive awards from these organizations for the amount of work that you do in the reduction in crime.
Well, that's true. One of the major awards that we just received was the International Association of Chiefs of Police Cisco Community Policing Award for our holistic approach to community policing approach to heroin initiatives, and that's resulted in a very proud moment for the men and women in Nassau County, because it's a very holistic approach where we partner with the various agencies throughout the county and the public.
Fantastic. And saving many, many lives doing that. So the Emergency Ambulance Bureau is part of your department. Why don't you explain a little bit what the EAB is and how do they fit into the policing model?
The policing model is a very unique approach to ambulance. There's not a lot of police departments in this country that actually maintain and control ambulance bureaus or ambulances. In Nassau County, we have an approach where we partner with the volunteer firefighters and answer the vast majority of all ambulance calls in Nassau County. We're responsible to answer approximately 65,000 calls a year. which accounts for somewhere around 63-64% of all emergency response for 80 cases.
Now, so you'll have these the police ambulances, the AB ambulance stationed on patrol. Are they are they situated at firehouses? Are they on? Are they driving in areas? How does that work?
They post throughout the county. We have approximately at any given time anywhere from 23, 24 ambulances up to 28 ambulance posts. And they are positioned throughout the county in the department's 5 precincts. And they respond, and it's a unique model, and it's very efficient, where they respond and the police officers act as their drivers and their EMTs to support the advanced medical technicians. So it's an advanced, every single ambulance that we have in Nassau County is an advanced life support ambulance.
So you have 23 to 228 advanced ALS, advanced life support ambulances, 24/7 available for citizens.
Yes, we do, and we have very quick response times, among the quickest in the nation, where an ambulance is going to be on the scene anywhere from 3 to 5 minutes on an emergency call.
And I mean, a call comes into 911, right? Police car is dispatched, an ambulance is dispatched for a medical case. Police officers are all over. They're very, very fast to respond, especially in Nassau County. I've never seen the zeal of which a police officer respond to an aided case to get in there and help someone. And so they're like an eyes and ears immediately on the scene, even before the ambulance gets there.
Absolutely. Every single police officer graduates the academy as a first responder, so they do have first aid training at a relatively high level. So they start the treatment the second they get there. If the person needs CPR, they're starting that CPR upon their arrival. Every single police car in the county has a defibrillator. It also has oxygen. So they're able to start basic life support until the ambulance actually arrives.
What a great concept. And I mean, this is something that should be emulated throughout the nation. I mean, your first responders, your police officers, who are pretty much ubiquitous in the county at all times. You can't, turn anywhere without running into one of the Nassau County police officers, on patrol, and they respond immediately to the homes. They're trained, they're equipped, they have defibrillators, which we know save countless lives, and and then they're able to get right on the radio and say to the ambulance, step it up, or we got some sort of special need you need it, at the scene.
It goes both ways. It's not only do they can tell the ambulance to step it up, that this is an emergency, they also can tell the ambulance to slow down. It's not an emergency. So that will provide less, the vehicles traveling at high rate of speed, and will mitigate the risk of operating at those high rates of speed.
Wow, it's really, this is a service that, most people don't even realize what the police officers do. So now the ambulance gets there, they have their ALS capabilities, and to save and to be efficient, now the police officers drive that ambulance to the hospital?
The police officers will drive the ambulance to the hospital, and then they'll immediately go back into service. So they're out of service for the, for the aided, and briefly after the aided, but then they're back in service. The great thing is just how many cars that we have out there, post cars. At any given time, there's 200 patrol cars, all with medical training. That's a force multiplier for that ambulance bureau.
It's amazing. And then you have special units as well, like the emergency service unit and some other highway patrol that guys have even more advanced training as police officers.
Absolutely. Our all of our ESU, our emergency services unit, are EMTs. And most of our all of our police officers graduated as first responders or EMTs, depending on when they went to the academy.
So we mentioned that they have oxygen and first aid equipment and defibrillators. How about the heroin, the epidemic that we're faced with heroin? What are you guys doing to help combat that and save lives?
In Nassau County, you're approximately 40 times more likely to die of a heroin overdose than be murdered. And so it is truly an epidemic in Nassau County. Earlier this year, we trained every single police officer on the use of Narcan, and by the end of the year we're going to train every single supervisor and detective, and what we'll see by the end of this year is over 200 people's lives that's saved by the administration of Narcan.
I mean, that's an amazing, statistic. I mean, here we have our young residents, basically the future in Nassau, and they somehow get caught up in the scourge of drugs, and they wind up on heroin, and now they overdose, and they die. They could die from this. Heroin stops your breathing. Your police officer first to respond on the scene, and they have this medication called Narcan that they can then administer to save this guy's life.
It is truly having an impact. We're seeing this year, at the rate we're going, it'll be approximately a 20% reduction in overdose deaths from last year. So we know Narcan is having an impact. We see it, and we only have, we're very optimistic about the future as we continue to battle this epidemic that is killing our young people.
I see it, at Nassau University Medical Center. At the Level 1 Trauma Center, we have one of the major emergency departments here in Nassau County, and we're constantly receiving your ambulances as well as the volunteer fire department ambulances. And we're seeing these young folks coming in on overdose, and you cannot imagine the scope of this and how wide-reaching this is across all demographics. Whether you're from the richest or poorest of homes, we're getting young men and women in the hospital overdosing, and we're seeing the results of what you guys are doing. So where we would receive someone who unfortunately may have had severe brain damage, and we may even had to pronounce them as dead, you guys are getting there quickly, and you're administering the Narcan, and not only are they alive, when they when they get them to the hospital, they're talking, they want to leave. I mean, it immediately reverses the effects, and this is a young life that could have been dead, and a family grieving, and now you have a second chance of saving them.
And that's Narcan, and we see it on the street where you administer Narcan and somebody, just about passed away, just about died. Mm-hmm. And they don't even want to go to the hospital.
Right.
So, we are using Narcan, and we are, that it gives a second chance, and hopefully that person gets into treatment. Mm-hmm. And we work with our partners to get that person into treatment as we move forward.
That's great. I mean, you have the defibrillators, and, they've been around now for quite a few years, where people who have heart attack and sudden death, and you guys get there, put the pads on, push the button, and shock the guy back into life, or at least attempt to. And you have the oxygen, which we know helps in so many different types of medical emergencies. And now this just altogether just gives your first responders, your police officers, the tools to really make a huge difference.
And that's not where it ends. We over the next 12 months, we will be training every single officer on the use and administration of tourniquets. When I became a cop 20 years ago, and I was an EMT, what we learned was tourniquets were an absolute last resort. And that's no longer the case. Tourniquets are saving lives. We actually had a police officer win an award for use of a tourniquet yesterday. Next year, when they go to the range for their annual qualification, they're going to be trained on the use of a tourniquet. And we'll be putting out, over 2,000 tactical tourniquet kits. And those tourniquets will save lives.
That's another area that you're going. So now you have a bleeding person's arm has been severely lacerated, or leg, or even, God forbid, a police officer shot. Now we have this equipment, this tourniquet, this medical bag that you're going to give all your officers with gauze and pads on it to stop the bleeding using the tourniquet. And we had an old saying in medicine, save a life but lose a limb. And the bottom line is you're going to be able to save people's lives, even in other cases such as severe bleeding and hemorrhage.
And there's, not necessarily a loss of a limb, because we're going to get the people to, a hospital very quickly, and they'll be able to, stop that bleeding and hopefully save that limb in most circumstances.
Absolutely. And yeah, exactly. At one time, we always thought when you used the tourniquet that was it. But today we're realizing that the amount of time that the tourniquet is on, that we can actually get that limb and resuscitate that limb itself once we get it into the hospital with some vascular surgeons and some vascular treatment, that we could open up those, specifically stop the bleeding vessel and allow other vessels to bring blood to those limbs. So that is another great piece of equipment that you guys are going to have on their ambulance. So we also have helicopters. You also have medevacs. Why don't you explain to us what that's about?
Nassau County Police Department maintains 3 helicopters. Those helicopters are operational, and they are frequently used for medevacs. And, there are a number of cases every year where those helicopters and that medevac actually saves the life. We had a young lady, police officer, who was seriously injured in an auto accident a couple years ago on the Southern State Parkway, and that helicopter clearly saved her life, because we were able to get to the Nassau County Medical Center and get her into a trauma room in less than 60 minutes, from the time of the accident. And that was put her in a trauma room, and rather than her bleeding out, rather than her bouncing around in the back of an ambulance, we put her into a helicopter, and that saves lives on a regular basis. Moving forward, in the next week, we expect to be putting on a bid out that will significantly upgrade our helicopters. Currently, the helicopters we use are Bell 407 helicopters. They're single turbine helicopters. They're not instrument rated, and we'll be going to a twin turbine helicopter. So we lose about 50 flight days a year. And unfortunately, you can't predict when you're going to have a trauma patient, when you're going to need that helicopter. So these new helicopters will save even more lives They'll go from that 50 lost flight days a year to probably less than 20 flight days a year that we lose due to weather or due to visibility. So our police officers on those helicopters are pilots. They are dynamic, and they can put those helicopters just about anywhere. And the observers on every one of those helicopters are advanced medical technicians. New helicopters will have even more capabilities as far as life support than the current ones.
So like flying ambulances, they have all the equipment that one of your regular emergency rooms might have, you might say.
They do, and they cut down, they can cut a, time to the hospital by, 75, 80%, 90%, depending on where the 80 case is located. You have something on the Barry Islands, over on Jones Beach or Fire Island or Long Beach or down in Bayville. To get to that person to a trauma center could take as long as an hour, depending on the time of day. That's a 4 or 5 minute flight. So putting somebody in a trauma center in that time will have a significant impact on saving their lives.
Yeah, we talk about the golden hour of trauma, and that's the hour that you get from the time of the impact to the time of getting this person to the operating room. And at Nassau University Medical Center, they're the level 1 trauma. We have the heliport right outside the ER. We know we receive your patients all the time, and we're standing by when you're there. You call us, you say you're coming in. We got the trauma surgeons down the ER, neurosurgeons, orthopedic surgeons. We're all waiting to see what you're bringing us. And when we get that patient up there, you guys package them, basically do everything you can out in the field. You have IVs, you have fluids going, you have medication started on these guys. And when you come in, we take a quick look at them, and sometimes we take them right to the operating room. We don't even have to intervene because your police officer, paramedics have done so much out in the field that really we just evaluate them quickly, maybe get a quick CAT scan and right up to the operating room if it's needed. So it really is making a big difference. And we could see with the helicopters, we see a different outcome. We see a decrease in morbidity and mortality by transporting those persons to us within that golden hour. And it's a pretty well-known fact, American Trauma Life Support, ATLS, that's what's necessary. What we call it is that you don't really need to be fooling around with them. They need 2 things, and they call them hot lights and cold steel. Get them up into the operating room and fix what's broken. And and you guys really help do us a lot quicker.
And you do a great job. It's unfortunately we've had a number of police officers that we've brought in, and the police department, the members, have the utmost faith in your ability to save lives, and you have saved our cops' lives.
Yeah, and we look forward to, doing everything we can, for all the population of Nassau County. And when we receive a trauma from you guys or the fire departments, we're ready for it. And we have the facilities, we have the staff, the training, and the equipment to take care of these patients. And it doesn't stop in the emergency department. We have 8 great ORs with some really great surgeons, and we just opened up a brand new ICU and a surgical intensive care unit. Matter of fact, we haven't even cut the ribbon on the ICU yet because it's ready to go. And so we're going to have a brand new state-of-the-art intensive care unit. So even after we save your life, or you guys save the life, we get them in the ER, stabilize them, fix them up in the OR. The care doesn't stop there. It continues so that we make sure that you walk out of that hospital feeling the best that you can. So we also have other stuff at the hospital that is part of the Nassau County Police Department, medical control. So we have the Nassau County Ambulance Medical Control. I want to explain to me what that is and what they do.
As it has to become very clear is that it's a partnership. We have a partnership not only with the hospital and the medical center in this case, and we also have a very strong partnership with the volunteer firefighters of Nassau County. Without all of us working together, we would not be able to provide the level of service that we do. Medical control is, as a cornerstone of that partnership. The medical control is staffed by Nassau County Emergency Ambulance Bureau, and what that is able to do is put AMTs in touch with doctors to provide guidance from the medical center. So every single 80 case that comes in is getting the best possible treatment that can be given on that ambulance, because the doctors are able to prescribe medicines right over the air, and they get the narcotics, they get the treatment they need prior to even getting into that hospital. And they actually monitor and control over 100,000 80 cases a year coming into that hospital and coming into the various hospitals in Nassau County. This is a true partnership. It's no one part is any stronger than any other part.
Yeah, so we have here at the medical center, we have an area, a room, where you have your AMTs monitoring radio frequency, and all the volunteer firemen and police officers, the EAB ambulances, when they pick up a patient, contact MedCom and they say, what we have, this is the patient that we have, and they'll ask if necessary to speak to the physician. The red phone rings in the ER. The ER doc picks up that phone, is able to talk directly to those paramedics on that ambulance through MedCom, and they could ask questions, the doctor could answer questions, or provide guidance or other types of medications. And again, it works out great. That'll give us an update. We know who's coming in. They'll contact, if they're not coming to Nassau University Medical Center, they'll contact the other hospital that patient is going to and give that person on the other end of that phone, the nurse or the physician at that hospital, all the information they need, so they're ready for that patient as well. So it really is a great system of keeping the hospitals informed of what types of patients are coming in. And we know now with some contagious diseases that we see, with the Ebola case in particular, since thank God we didn't have any Ebola cases, but we had lots of scares. We had patients that maybe meet that criteria based on their recent travel and presenting with a fever, and that the EAB and the volunteer fire department had to respond to those homes. And using all the proper precautions, notified us at the hospital that they were coming in so we could be ready when that patient arrived.
And that's very important. One of the things that we worked with the Nassau County Department of Health, the Nassau University Medical Center, also all the volunteer fire departments, we set out very strong protocols that ensured our first responders were going to be safe, and also assured that we provide the highest level of care if we had an Ebola patient in Nassau County. So in our case, not only do we have an ambulance respond to those cases, we also will assign an emergency services unit. So those are the things that we look to do on a regular basis, is work together to assure the highest level of care, but also we are looking to make sure that our first responders are safe.
Right, so I mean, and that's true, and you guys really were on the forefront of that. I mean, we noticed back in August, even before the first patient, Duncan, was over in Texas, that we had a case of a person that meet that criteria, and I know you responded personally to the emergency department to oversee what was going on with your people, with the police officers, and they did everything. They put on the proper protective equipment, they notified the hospital, and we admitted that person to our isolation rooms, and luckily the person did not have Ebola, had some other medical issue, but we were relieved to see that you guys were already beginning to get on top of this, and then you began training all your officers, equipping your officers, particularly the EAB, the Emergency Ambulance Bureau guys, with protective equipment, so that sure, if they're responding to the scene, that they'll be protected from any type of contagious disease and bring them to us safely. And now what we're doing at Nassau University Medical Center on the ground level, we're opening up a special area just to receive these types of patients. We'll have its own separate entrance, its own separate decontamination showers, and negative pressure rooms to handle these patients. So it'll be separate and distinct from the emergency department if in fact we should get a case like that as well. So, I mean, this is just another area where you guys are staying on top of things. We also have at the medical center a training academy. We have the Police Fire Training Academy, and why don't you tell us a little bit what that is?
The Police Fire Training Academy is actually a joint venture between the Nassau County Fire Marshal's Office and the Nassau County Police Department, and what we do is we train volunteer firefighters, and we train our police officers and our emergency ambulance AMTs, and we train them on all levels of medical care, whether it's a first responder, whether it's EMT, or whether it's a AMT or paramedic. We provide regular classes for the first responders, whether it's their new training or their recertification. That Fire Police Academy, it's a very unique adventure. It's basically a true partnership where we have not only staff from the Nassau County Police Department, we also have staff from the fire marshals working side by side, teaching classes every single day.
And that's great, because we're dealing here in Nassau County with a lot of volunteers, and a lot of these volunteer fire departments and ambulance squads do not have the capabilities of training their own people and certifying them to the level of which is required by New York State Department of Health. So here you have a facility, state-of-the-art, beautiful classrooms, manned by, like you said, fire marshals and the police officer trainees or trainers, and you're training not just your own people. You're giving you're giving lectures and classes and certifications to all the volunteer fire departments and ambulance squads, so that they're all getting the finest training through that.
And several thousand people a year are being trained in that environment. There are other, programs in Nassau County, but, we're very proud of that. I know the Chief Fire Marshal, Scott Tusa, is also very proud of the work that we do there on a day in and day out basis. It is a true example of partnerships. There are other agencies in this country that don't enjoy the relationship between the volunteer firefighters or the paid firefighters and the police. And in that, here in Nassau County, we don't have that competitive relationship. It's more of a partnership than anything else.
Yeah, and I see that all the time. I see how the police and the fire service work together when they bring the patients in. Most times, there'll be the EAB ambulance will show up, your emergency police ambulance, and they'll have one of the firefighters inside it, or the fire service will show up, and there'll be one of your paramedics or EMTs in that ambulance. And it's sort of like a seamless transition. It's as though they were partners from the beginning, how well they work together.
The relationship's dynamic, and I'm a firm believer that part of that relationship is due to the long-standing relationship between the ambulance bureau and the police department and the volunteer firefighters has fostered the relationship we have with the volunteer firefighters. They do great work. They give to the communities, and they ask and get nothing in return. Every day they're being called out at all hours of the day and night.
It's true, and we feel the same way, and I know you do. And so, I mean, the idea that people volunteer and at 2 a.m. they get out. We really take our volunteer firefighters for granted out here in Nassau County, and volunteer ambulance workers. I mean, these people are really out there. I see them in the emergency room 2, 3, 4 in the morning. You'll see these guys showing up, and they got to go to work the next day. They have families, and yet they leave the comforts of their home, especially on a night like last night, or when it's really getting chilly now. It's kind of hard to get out of bed at 3 in the morning to run, but they do it. They're a really dedicated crew, and your guys are out there working with them, and it basically gives you that whole continuum of care for the citizens in Nassau County, that they have such a professional police department where the rank and file police officers are trained, equipped, and motivated. And these guys are motivated to go and to do the right thing and to actually help people. Such a service-oriented police department. And then they show up and they call in a real top-flight crew like your EAB guys or the volunteer fire departments. They show up, they work together, and take the patient to the hospital with a great handoff. I mean, really, it is a great service, Commissioner, that you guys provide to this county. So, I mean, we're looking forward to this. We think there's plenty of places to go in the future, with emergency medicine. Constantly in medicine, things are changing. We look forward to working together with the instructors at the Police and Fire Academy, as well as some of the other academies out in Nassau County, to make sure that the highest level of training is given to the members out there. And by you taking the ball and running with it with your department, and sort of getting in front of it, I know you have a lot of support from the county executive. I know anything that is good for the citizens. I know, Commissioner, you bring them up to county exec and Rob Walker and come up with some really, really innovative ideas. And I know if they feel that it helps the citizens of Nassau County, that they're all for it. So, I mean, we can't say enough about what you're doing for the county. I think there's so many other things that we need to talk about moving forward. I would love to have you back. Next time we could talk about some policing issues, especially with the holiday season, how to keep us safe and, always be, aware of our surroundings and stuff. So.
Well, thank you for spending some time with me this morning. It was definitely, a unique experience, and it shines a light on an area of the police department that is often overlooked, and unfortunately, it's definitely, from our perspective in the police department, so it is very important. It's very important to the residents in Nassau County. It's very important to our members, because not only are they out there, providing that emergency first aid for the public, they're also the first on the scene to take care of our cops when they're injured. We value that bureau. We value everything they do, and they contribute a lot to the residents and to this department.
That's great, Tom. Also, I mean, this was Health Watch. We really appreciate everyone tuning in today. I mean, I really enjoyed this discussion. I mean, and I think most of the listeners really didn't have any idea what these police ambulances were doing driving around and how that worked, and what was their level of training. Were they police officers? Were they AMTs or paramedics? And what exactly they carry. I mean, and so it's great to know they have all the latest drugs, that they're equipped with the latest medication for pain control and to stop seizures. And it's good to know that the police officers are also equipped and are ready to get out there and help people. So I had a really great great talk with you, Commissioner, and thank you for being here. And to our listeners today, have a great day. And now when you're riding around and you see those big police ambulances, give them a wave and say hello. All right, this is Dr. Victor Politi for Nassau University Medical Center, Health Talk. Wishing you all a great day. Thank you.